Hello everyone, I'm Jon Salmanton-García from the University Hospital of Cologne, and today we would like to present you the results of our latest publication, The Current State of Laboratory Mycology in Europe, Diagnostic and Treatment Capacity. These are my disclosures. In Europe, the invasive fungal infections are a major threat for different kinds of patients, mainly patients admitted in ICU, patients with malignancies, also patients receiving HSCT, patients with organ transplantations, and also patients with viral respiratory infections due to different viruses such as influenza or SARS-CoV-2. With this research, we aim to decipher the current diagnostic capacity and the availability of treatments for invasive fungal infections in order to guide health professionals, patients, and policymakers. We did this with an online registry. That registry, or the link to this registry or survey, was provided to in three different ways. The first one, sharing it with different traditional collaborators, members of the European Confederation of Medical Mycology, and also of the International Society of Human and Animal Mycology. The second way was looking for potential participants in online search engines such as Google Scholar, PubMed, ScienceDirect, or clinicaltrials.gov. And the third one was disseminating the link in our social media, such as LinkedIn or Twitter. The initial step of this research we are presenting today was in the Caribbean and Latin America, where the same initiative was started in 2019. Then it was expanded to Africa, to Eastern and Southeastern Europe, and then to Europe. Afterwards, we repeated also in Asia and the Pacific. The first section of the survey was the incidence, and we asked about the incidence perception in the different institutions. We could see how for most of the sites, regardless of the GDP of the country, the perception was to be very low or low, even moderate, the IFI incidence. And in the countries with the highest GDP, with more than $45,000, we could see how it was most frequent, the moderate concern. For the most frequent pathogens, we didn't really see any big difference between the different countries. The first one, Candida species, afterwards Aspergillus, then Mucorales, Cryptococcus, Fusarium, and not really a frequent pathogen, Histoplasma. The second step was diagnostics. Here we asked about microscopy, and we could see how it was accessible almost in all the institutions, and how more than 50% of the institutions were using it always. Regarding fungal and antifungal identification, more than 90% of the sites in some areas, in every institution, it was available, this test, and it was possible to perform in 90% at least, as I mentioned before, the species identification. For the serology, we can see how this was available in at least 80% of the sites. In the countries with a GDP between $30,000 and $45,000, we can see how the access to Candida serology is in the 50%. Also, and for example, for countries with the lowest GDP below $30,000, the access to Histoplasma was the lowest one and was around the 20%. For antigen detection, we didn't really see big differences in the trends. Actually, there were differences between the different countries. There was access to at least one antigen test in at least 80% of the sites. The most frequent one was any of the different kits for Aspergillus, afterwards for Cryptococcus, and also the access to beta-glucan was present in more than 50% of the analyzed institutions, except for the countries with a GDP below $30,000. For molecular tests, we could see how overall the access was about 80%, and only the countries with a GDP below 30,000 US dollars had a lower access, around 60%. For antifungal drugs, the third and last section of our survey, we can observe the following data. We could see first that the access to liposomal amphotericin B was around 80% at least, and this was a bit lower in the case of the countries with the lowest GDP, where the access to liposomal amphotericin B was around 50%. And we could see also how there was a clear trend in the access to both flucytosine and terbinafine based on the GDP of the country. For echinocandins, we can see how there was access to at least one echinocandin in the 80% of the cases in any geographical setting, and always the most frequent one was the caspofungin. And for triazoles, we could see how almost any triazole was accessible at 80% of the institutions in any geographical setting. The only exceptions are isavuconazole, both in the countries with a GDP below 45,000 US dollars, and also in the countries with the lowest GDP, below 30,000 US dollars, we can see how the access to itraconazole is around 70% and the access to posaconazole in the 50%. And specifically speaking about posaconazole and also isavuconazole, we can see now how there is again a trend in the access to these two newest antifungal drugs based on the GDP of the country. And in the countries actually with the largest or the highest GDP above 45,000 US dollars, in around 80%, 90% of the institutions, isavuconazole and also posaconazole are available. And last but not least, therapeutic drug monitoring. In this case, voriconazole was the most frequent, or the TDM for voriconazole was the most frequent one, around 90% in the countries with the highest GDP. In the countries with the lowest GDP, it's around 20%, and there was overall access to at least one TDM or access to the TDM for one drug in 90% of the countries, or 90% of the sites in the countries with a GDP above 45 US dollars. In the 60% of the countries with a GDP between 30 and 45,000 US dollars, and in a bit more than 20% in the countries with less than 30,000 US dollars. And conclusions we can draw are first that there is a general status, a general good status of diagnostic capacity in Europe for many countries. Actually, there are substantial differences based on macroeconomical situation of the country, as we have seen. Therefore, inter and intra-regional collaboration is necessary, so every patient in Europe can receive the best diagnostic and therapeutic management, and finally get the best possible outcome for the IFI in these patients. The results and further results than the ones we have presented today are available in our publication in Lancet Microbe. Thank you very much and see you next time.